there, it's Huang here with Hand Therapy Secrets. I wanted to share a story of a patient that we're currently working with, and he's just really frustrated with all of his pains, his limitations. He's had surgery, so he's 2 separate surgeries. He had a carpal tunnel release and ulnar nerve release, and then on the other hand, he had a carpal tunnel release. And I can't remember exactly the order in which he did it. It was one hand and then the other hand, but the surgeries didn't necessarily help him, and he's trying a bunch of different methods, a bunch of different therapy services, various therapy services, not just our therapy services. And though he has made improvements, he is still really frustrated because his problem still hasn't quote unquote gone away. And one of the things that he was like, I've done this, and he's like, I still don't understand like why I have all of this pain. And he's just went for an MRI for his neck, and he's just so frustrated. He comes in and he's like, I'm so frustrated. And as therapists, we need to understand, one, that they're frustrated, but 2, how to speak to them in a way that makes sense to ease their frustration and let them know that we know what we're talking about and what we're actually doing. Because I truly believe that though you might do certain things right, there is an order in which to do things so that we can be more effective, right? So I explained to him, pretty much a lot of the ways in which I teach is the same kind of language in which you can use, towards your patients. And so I explained to him essentially the 5 components of a framework that I developed to help not only therapists think through the kind of cases that they're seeing to help them figure out where the problem is, but I use that same framework to explain why to a certain patient, why they're not getting the results that they want like yesterday, right? Because everyone wants to get better yesterday. They wanted to not have the problem, they wanted to get today, right? But here's the thing that I, usually tell my patients to look for. And because there's progress, but a lot of times people don't always see the progress. So when I use like, hey, this is what's happening with your joints, this is what happens with your muscles, this is what happens with your ligaments, he was like, yeah, that makes sense. And then I was like, things have improved. It's just that what you're looking for is you want to see a reduction in symptoms, right? It's not gone away because we haven't yet fully solved your problem. It's gone down, but it's still there. The frequency in which you have those problems have also gone down. The intensity. So if you came in severe, now you're mild to moderate, like, whew, you're making progress, right? And he agreed, I am making progress. It's just not fast enough, right? Yes, it's not fast enough. Maybe it's because you're doing shit out of order. Maybe it's because you're going to all these other services, all these other places that are, not as, not, how do you call it, cohesive. Maybe you're doing some of the things that it's not wrong, but it's not necessarily all that correct, right? We can always tweak things. I always say, for example, if you're doing a particular stretch, right? If you're doing a shoulder stretch, like let's say, for example, you're doing a pec stretch, but you're not really effective because you keep looking down, then that shoulder pec stretch is not as effective as if you improved your posture, looked forward, and then did it, right? So just because you're doing a pec stretch doesn't mean that it's most effective, right? So we can tweak things. Now, why am I sharing this with you about a patient? I am sure you have those types of patients too, and it helps to know what to say, how to say it, and how to think through that particular problem so that you can actually, get someone better, right? So that same approach and philosophy is essentially what I do to work with students to help them get better, right? To help them get the results that they hope for when not just when they're working with their patients, but how to get that type of result when they're starting to become a certified hand therapist. So I spent a lot of time when I opened the exam prep program, spent a lot of time talking to people who are frustrated, who've studied and stopped, They're really frustrated. I'm going to tell you a story of how I spoke to somebody who studies and then keeps failing, right? Now, if you study and you keep failing, you might be like this patient I was telling you about, where he's trying all these, he's literally taking shit and chucking it on the wall and seeing what sticks, right? And just because you're studying doesn't necessarily mean you're studying effectively. Just because you're spending hours upon hours studying doesn't mean you are studying efficiently, right? So somebody's got to say that shit to you, and it might as well be me, right? I spoke to a gentleman, and he wanted to talk about the exam prep program. He's like, I've been following you for years. I really like your style, but basically he won't come into the program for years. He's taken the test numerous times, watched my stuff, still won't come into the program. And he's like, well, I've done this. And so sometimes when you get cheaper options, right? You have lots and lots of options. You have lots and lots of choices, right? But just because you're studying doesn't necessarily mean you're being effective. And so in speaking with him, I was able to identify what the issues were, right? You could be studying from the right resources, but you're not using your resources correctly. Everyone studies differently. Everyone absorbs and does differently. But here's what happens, right? When you compare how you study to how someone else study, and then you're wondering why they keep passing and you keep failing, that's not the right question, right? The question isn't how come they pass and how come I'm not passing? You're not the same person. You study different, your work experience is different, how your brain works is different, right? So instead of looking out at someone else, maybe you should look at yourself and say, how am I studying or using my resources that is not effective or efficient, right? So in order to make changes, you've got to look inward more than you look outward, right? So number one, found out his resources, not using it as well. And based on how confident he was, how well spoken he was, one of the things I do is a score audit. So I usually provide score audits for my members. So people, if you join the program and you've failed, it doesn't matter how many times, I take a look at the score and we review what you've done in the past, what are the resources, how are you studying? Because all studying is not the same studying. Don't think just because you're sitting there and you are reading something that you actually understand the concept. Outside of understanding the concept, you may not be applying it, right? I'm gonna say it because somebody might not be saying this to you, right? So listen, if there's anyone who, is going to tell you, it's gonna be me, right? Because I would hate to be the person that nobody, if I had a booger up my nose and I'm on these films and not one friend of mine told me I had a booger up my nose and I'm walking all day around, at the end of the day I found out I got a booger up my nose and nobody fucking told me. That's like you studying for the exam and no one having the freaking balls to tell you, hey, you know what? How come your score is so low? Based on everything that you're telling me, I'm really shocked that your score is so low. Let's find out what is really actually going on here. Because I could sit here and stroke your ego. Oh yeah, you so good. But is that gonna actually fucking help you pass the damn CHT exam? It's not. Right? Right, so it's not. And it's not to be mean. It's actually to have a really fruitful, intentional conversation about what needs to happen next. Right? So that's the other thing, like, so outside of resources, the question that needs to be explored is, how effective or efficient is your studying? You see this, brachial plexus behind me? Go ahead, take a picture if you need to, right? That is useless information if all you are doing is memorizing. It's completely useless. Completely useless, right? If you have no ability to apply the information that you know, not only will it not help you with your patients, right? Not only will it help you to feel confident and qualified as an occupational therapist, as a certified hand therapist, but most likely you won't pass, right? Most likely you won't pass. So it's, when I say it's not about memorization, I'm not pulling that shit out of my ass. I'm really not. I think that the things that the exam is requiring us to do is what we should be requiring of ourselves, and in order to help our patients in a way to get results, right? Now, just because you are, you have a mentor or you're learning from another CHT, doesn't necessarily, just because they studied to become a CHT before, doesn't necessarily mean that they know how to teach and explain it to you based on how you need it to be done, right? Just keep that in mind. If you keep going, and there's people who can say that they mentor you, right? And there are really great people out there who's like, they'll answer a question for you, they'll tell you what to do, right? But very few people help you to think through what you need to do, not just this time, but the next time. Not just when you have that patient come in, but when you get another patient months from now. Not when you are, doing practice questions, but when you're faced with questions on the exam that, are brand spanking new, right? The questions are the questions, but the way you think about them is truly where the biggest differences can lie when you are sitting there and going through the exam. There's multiple factors when it comes to taking the exam, and one of the reasons why my exam prep is more of a program than a course is because I do value and want to provide more of that personalized help for the members inside the exam prep program, right? It is more personalized because everyone studies differently. So we all go through the same curriculum, right? We all go through the same curriculum. We follow a particular cadence. So there's certain things that fundamentally are the same. You have to do this first to get to the second thing. The order in which you study and the order in which you do things makes a difference in terms of trying to make your life a little easier. Now, y'all people can make this shit hard if you want. He's like, Huang, I can't afford your program. Well, is it because you can't afford it, or is it because you don't want to afford it? Right? Because you're gonna keep, you've been watching me for years, you believe what I say, you like my style, but somehow, or another, and you know that becoming a CHT, the financial rewards on the other side of that passing, the outside of money, everything else is on the other side of it. The respect, the choices, your options, how you feel on those is all on the other side of it. And I can guarantee you it's not about the money, because I have worked with people who have had like zero job and they have found a way to make that commitment to themselves. And while in the program, gotten the job in outpatient, became a CHT, and then doors literally opened for them once they made that commitment. So, I can tell you 100% working in a, doing this for a while, so much of it is not the money, because if I can guarantee you the results, you would not have a problem committing. And it is more about the fact that you might not believe that you can do it, right? Due to past experiences. So part of the process is learning to trust that if you do make that commitment, your results are on the other side of it. So take that with a grain of salt. take what you need from that and leave what you don't, right? Like I always say that, take what you need from it and leave what you don't. But take into consideration that sometimes if things are not working and you're doing the same shit, could you consider possibly making a change, a tweak, and maybe potentially working with somebody who's not just going to stroke your ego, but to actually deliver, with you on the results that you want, which is how to become a better critical thinker and decision maker in order to pass. Because if there's 3 core requirements, if you're just sitting there and studying, but you're not getting the results, then there is something missing in your formula. And that's all I'm going to say about that. So I'll share more details of what the exam prep is all about. If you so desire, I'll share the link with you somewhere here below, and you can take a look at the details, and then you can apply to come into the exam prep program. I am looking for occupational therapists and physical therapists who are serious about studying to become not just a better clinician, but also to pass. All right, thanks very much for watching. My name is Huang, and I look forward to talking and working with you. Hey therapy friends, it's Huang here. Thanks again for watching my video. And if you like videos like this that can help you just crush it in the hand therapy world as an occupational therapist, then hit the subscribe button and enjoy the video. Thanks again for watching.